Doctor's visits can be scary for everyone, but add in a disability and oftentimes patients are restrained or heavily sedated in order to complete tests or exams. Well, one mom decided she just could not bear to watch her son in such fear and agony at every appointment. So she created an entire new therapy designed to put control back in the hands of the patients.
The philosophy of practice without pressure is to help people to participate in their own care without restraint in greatly reducing sedation. It's also about bringing the caregivers into the process and working with clinicians and professionals to help them understand what the people are capable of.
Sit right here, and I'm just going to put your back. There we go. And I'm going to go down.
Someone becomes afraid. It could be when you see the needle, it could be when you see the tourniquet, it could be when you walk in the door. So we find out in our consultation where the fear comes in. We work with the caregivers to help them learn different ways of working with the individual. And then we practice so that people can become familiar. They can own their own procedures, their own behaviors. Stephen does not like anything in his personal space, so we go back and forth between him and mom. He's just a totally different kid right now. Practice Without Pressure was born from issues I had with my son Mark getting care. My son Mark has Down syndrome and some major heart and other health issues. And he was restrained and sedated so much that I knew something else needed to happen. So I created the PWP philosophy and model because of him.
David Amron, he is the manager of PWP here in San Antonio at Morgan's Mac, joins me now to talk more about it. Hi.
Hi, Leslie. How are you?
Good. Welcome to Inclusion Unlimited.
Thank you very much for having me.
You know, when I interviewed Deborah, which, by the way, what a fantastic movement to start, her dream and her hope was to see the whole program grow. And even here, it's already grown. Tell us about what the program is here at the MAC.
Yeah, well, I'm in my 6th month working here as the manager, and even in just the 6 months that I've been here, we have maybe tripled the number of sessions that we're doing per month. So we're serving much more members. We're at about between 250 and 300 sessions a month, where we're meeting members usually twice a week in our practice suite here at the MAC and helping them practice and get ready for either their medical, dental, or personal care procedures.
How many sessions does it usually take to prepare them?
Everybody's different, as we know too well at the MAC, right? There's no one size fits all, and we intentionally don't put an end date on our sessions. I would say kind of on average, just to wrap your head around it, is probably about 2 to 3 months for most of our members to prepare twice weekly for the procedure that they're practicing for. But for some folks, that can be a month or less, and we have some families who've been with us for a year.
I think one of the coolest things, at least that I've seen here at the MAC, is the way the entire facility has been set up. Talk about how, because it's so realistic, so they really get to experience what that's going to be like. So talk about that.
Yeah, so our suite, which is just for Practice Without Pressure, has a bunch of small rooms to practice different procedures. And we have 2 that are designed to look just like dental bays. In fact, they use even the same chairs and other devices that are in the actual dental spaces in the MAC. And then we have 2 rooms that are built just to look like our CommuniCare medical offices.
Like a primary office for a visit.
Exactly, right? We've got the sink, we've got the otoscope on the wall, we've got the thing to sit on.
Yeah. What is it called? There is a name for it. It's not a hospital bed. Well, we know what you're talking about.
I mean, it's funny because I am obviously not a doctor or a dentist, but I feel like I play one on TV now because I'm getting out the stethoscope and practicing with my members. And for some of them, maybe they're scared of seeing the tools because it reminds them of when they've been restrained or sedated in the doctor's office in the past. So I'll say I'm going to hold it for 1 second, and then I'll do that, and then I'll say if you can do 1 second, I'll do 3, and we'll build from there just a little bit at a time.
And one of the coolest things about it that I don't think I talked about in the story is how you empower them by giving them a little sign that says stop.
Absolutely, right?
So that is empowering them to say, okay, no, this is enough for me now, right?
These are folks who basically have all had the trauma of being restrained made to do something that they don't want to do at the doctor's office, and it triggers a fight or flight response for them. So we're doing something that may be counterintuitive, and we're actually giving some of that agency back to these individuals and allowing them to say, stop, I need a break, this is too much. And we listen to them in whatever way they say that.
You
right?
really like go back, right? I mean, you just say, okay, all right.
For some of them, for a lot of them, it's a stop card. We always have one there. But for some, they'll sign it, or of course they'll say the word, or even if body language reads stop, we say, I think you're saying stop now, and we're going to take a break. We'll move backwards. We'll bring the energy down. If we have a tourniquet around their arm, we'll untie it. Whatever we're practicing stops, and we all breathe together, and we take a break before we resume again. It's kind of like a stop sign. It's not like we've arrived at the store and we're getting out of the car, because we're not done with our practice. But it's like we're going to stop, regroup, and then
do
start
it at
again.
your pace.
That's right.
Which is the whole point.
Yeah.
What is it like to witness from when they come in to when they are empowered to walk into a real procedure and have some responsibility for their own care and presence in the room?
So I have yet to experience that full journey, because I've only been at the MAC for 6 months, and I'm learning myself to be a practice specialist. I'm also a caregiver, and my daughter is going through the program. So I have started the journey with several folks, but I have not finished that full journey yet. And so for me, not having experienced that yet, there is an active leap of faith that we're going to get there. But I see it in my colleagues and in the other members that come into our practice.
Do you see growth and change, though?
Oh, absolutely. Yeah. No, I see many folks who are progressing steadily toward that and slowly gaining trust and confidence and beginning to participate on their own in these procedures. They don't always love doing the procedure, and we're not trying to teach them to love getting a shot or love going to the dentist, but we're trying to get them to choose to participate on their own and to empower them to make that decision themselves.
And for people who are watching, if you want to know more, you can go to morgansmac.org, and there is a PWP section where you can read about it. But for people who are not in our area or not MAC members, but they want to try to implement this in their own lives, do you have any advice for them?
Yes, I do. I mean, firstly, we hope that this is something that will spread across the country. The Texas legislature is currently taking up a bill that could hypothetically fund or reimburse Medicaid, which means this would be something just like other therapies that would be covered by insurance.
That would be amazing.
So if that happens, and if it's not now, it'll be in the future, we think. So when that happens, that will really empower this to spread across Texas. And then we hope that Texas becomes a model for how other states can also begin to change the way healthcare is handled with individuals with disabilities.
Well, and then hopefully across the world as well, right?
Absolutely. So sadly, right now, this isn't spread across the country or the world, and we hope that it will be one day. But if you're in San Antonio, we have this resource for MAC members. If you're not, there
Give us one tip, like one thing you'd say, the best thing you can do to start the journey to help immediately.
Sure. So for caregivers who want to practice at home, I would say that as a caregiver myself, the number one thing is to listen, to pay attention and listen, but listening meaning to all body language, all behavior is communication, and really honor what the individual is saying in order to take them through that journey. Because it's not procedure first, it's person first, what we're doing. And listening to the person and what they're saying is really the first step in that journey.
Well, I can't wait to have you back on when you do see your first person through the end of it.
Absolutely.
And you'll share the story with us?
I will. I'll come back.
Thanks for all you do.
Oh, thank you, Leslie.
David, appreciate you having you.
Absolutely.
And as always, thank you so much for watching, everybody. Please like, subscribe, and share. See you next time.